The thought that comes to my mind as I look at this bill is something that my mother told me many years ago when I was a young boy, writing out my Christmas wish list. She said, "Joe, be careful what you ask for." And I would say, "Henry, be careful what you ask for." We have a bill before us with the best of intentions. We have members on this committee who have spent their entire career, and as you pointed out, the Dean of the House Delegation, John Dingell, has introduced a comprehensive health care reform bill, I think, every year that he's been in the Congress, and before him, I think his father did the same thing. So it is not the intentions that we doubt, it is the actual work product. When you have a bill that the CBO, in a closed, members-only briefing, admits that they scored based on a verbal explanation of majority staff, that even with that cursory, primitive analysis is $1 trillion, $1,000 billion cost increase over 10 years. In reality, the number is probably twice that, because the bill doesn't really begin to kick in until the year 2014. And the average cost from 2014 onward is over $160 billion per year. It doesn't include the macroeconomic effects, doesn't include an analysis of how price increases will affect the private insurance market. Just the pure additional coverage in the bill is going to cost $1 trillion over 10 years. Be careful what you ask for. Now, the additional bureaucracy that's created by this bill includes the Health Choices Administration, the Health Insurance Exchange, the Health Insurance Exchange Trust Fund, the Government Health Plan, the Bureau of Health Information, the Health Benefits Advisory Committee, the Center for Quality Improvement, the Comparative Effectiveness Research Commission, the Comparative Effectiveness Research Trust Fund, the Council for Comparative Effectiveness Research. Mr. Chairman, those are all brand new agencies, brand new bureaucracies. Each of them will have their own staff, their own budget, their own agenda, and they will interact with each other and with the market that currently exists in ways that we don't even know. We don't even know. We have a bill before us, Mr. Chairman, that is going to, just by common sense evaluation, devastate the private health insurance market. Now, you and the President have all said, if you like what you have, you will keep it. If you like what you have, you will keep it. But let me posture this. You have 10 employees in your business. You pay them an average of the average income in this economy is $40,000. So let's say you have 10 employees, you pay them each $40,000. You have a private health insurance plan that you provide that costs you $7,000. That's an average. Some plans cost more, some plans cost less. As the employer, you compare that $7,000 to the $40,000 total compensation package, and it's over 8%. You can dump them into the exchange or the public plan and pocket the difference. You're not going to, if you like what you have, you're not going to get to keep it, because anybody, if you assume in the CBO score yesterday, the average subsidized cost was somewhere between $4,600 per person to $5,700 per person. If you take a number of $5,000 at 8%, that's $62,500. Anybody that makes less than $62,500 and whose insurance cost from the employer perspective is more than $5,000 is going to have a financial incentive to be dumped into the public plan. That's just economics. So when you say if you like what you have, you can keep it, That's only true if you make more than $62,500. So I'm not sure who put this together, but the plan that is in the bill before us is a direct attack on the private health insurance market and provider market in America today. A direct attack. So for the 83% of the American people who like what they have, this plan is a direct attack on you. There's no other way to put it. So, Mr. Chairman, suffice it to say, we will have a number of perfecting amendments. We will operate in good faith, but we are very, very leery of moving to this brave new world, which within 5 years would so change the way health care is provided, paid for, and distributed in America that we won't know the health care system. And I don't think the American people, you know, another axiom is, if it ain't broke, don't fix it. Well, let's focus on what needs to be fixed. But let's don't revolutionize health care as we know it in America on a scheme that, to me, seems self-evidently guaranteed to fail.